Yeah, a very good evening, students. Let me check. Let me check whether it's. Yes. So I'm audible. So, yeah, a very good evening once again. So, as you know, today we'll be taking. Let me take my pen. Yeah. So, we'll be taking rapid fire questions on environment and health. So, yeah. Good evening, everyone. Good evening, those who have joined. So we'll take rapid fire questions. We'll try to take more than 15 questions. Okay, so that we utilize the proper time. And to inform your students, means tomorrow also I have a YouTube class on recent advances. In addition to that, day after tomorrow on Unacademy platform, I am having a special class on numerical based previous year question. So that will be also important. So all questions where certain calculations, certain formula is required. So I am taking that so in the morning so you can join. And I have planned a course plus course on Unacademy platform, the last minute capsule course on the entire subject, a quick revision for the exam, right? So these are the all the things which is coming on cards. Okay, Shreya and others, let's start. Let's start with the first question, right? The first question is the easy one. Safe and wholesome water does not include B. So what is not a part of safe and wholesome water? Is it free from pathogenic agent, free from harmful chemical substance, free from color and odor, free from chlorine? Just try, students. Anyone? Meena, Prachi, Shreya. So, which is not a part of safe and wholesome water? Is it free from pathogenic agent? Is it free from harmful chemical substance? Free from color and odor? Yes. Sanam has answered D. Anyone else who wants to try? Which is not a component of safe and wholesome water? So is it the safe and wholesome water does it should be free from pathogenic agent, free from harmful chemical substance, free from color odor, free from chlorine? Yes. So safe and wholesome water should be free from pathogenic agent, should be free from harmful chemical substance, should be free from color and odor, but it should have chlorine. You know that it should be there. So the answer goes D. Okay, we'll talk on this. So you see, safe and wholesome water should be free from pathogenic agent, one line, pathogenic agent, free from harmful chemical substance, free from color and odor, and it should be usable for domestic purpose. If all this criteria is fulfilled, it is called safe and wholesome water. If it is not fulfilled, it is not called safe and wholesome water, right? Okay, let's take the second question now. This is the second question. All the following statements are true about breakpoint chlorination except. So all the statements are true about breakpoint chlorination except. The first option is free chlorine is released in water after breakpoint chlorination. So is this correct or not? Chlorine demand is the amount needed to kill bacteria, oxidize organic matter and neutralize pneumonia. 1 part per million free chlorine should be present in water after a breakpoint has reached. Contact period of 1 hour is necessary. Try this. Yugandhar, Shreya, Aisha. What do you think? Which statement is not correct in this? You can see in that way. Yes. Anyone else? Yes, Sanam, I have seen your answer C. Anyone else who wants to try? So which statement which doesn't go along with the breakpoint chlorination concept? Free chlorine, correct. Chlorine demand is the amount need to kill bacteria, oxidize or is correct. 1 part per million free chlorine should be present in water. This doesn't go, students. This is wrong statement. This doesn't go as far as breakpoint chlorination is concerned. And contact period for 1 hour, this is correct. So my option, the answer should be C. Rahul, Deepesh, everyone, good. Now, okay, let's take the third question. Minimum chlorine content of water after chlorination should be. Let's be fast. Minimum chlorine content of water after chlorination should be. What do you want? How much chlorine content you want in the water? Is it 0.5, 5, 0.05 or 50 milligram per liter? Just try, students, this. Let's be fast. Minimum chlorine content of water after chlorination. What do you want? Yes, so Deepesh Sanam has answered 0.5 milligram per liter. Absolutely correct. So the minimum free residual chlorine content should not be less than 0.5. It should be 0.5 milligram per liter. Absolutely right. Now, 3 points. Whenever we are talking about drinking water, students, it should be 0.5 milligram per liter or greater. It should not be less than that. 0.5 or more per liter for a contact period of 1 hour. But when you are using a water which is post-disaster water body, so there is a possibility of contamination. So the residual chlorine level should not be less than 0.7. So it becomes 0.7 milligram per liter. And if you are trying to, for swimming pool, it should not be less than 1 milligram per liter. And the contact period should be 1. So 0.5, 0.7 and 1 milligram per liter is the residual chlorine level which should be there for a contact period of 1 hour. Okay. Now, you know what happens the moment you start adding chlorine. So what happens? The chlorine will start reacting with, and chlorine will start reacting with bacteria, organic matter, inorganic matter. So that will, the chlorine will start reacting and it will saturate till it gets saturated. The water gets saturated. That point is reached, and after that point, so how much chlorine is required to destroy bacteria, oxidize organic matter or neutralize ammonia? That is called chlorine demand. So once that chlorine demand is met, so you reach that break point, and from there, after you keep on adding chlorine, the free residual chlorine will go up, will rise, and it should be 0.5 milligram per liter for a contact period of 1 hour. So this is chlorination. Okay, so let's understand in the best possible way. So you keep on adding chlorine, and when you add chlorine, so amount of whatever chlorine you have added, that is chlorine dose. Now that chlorine which is used or which is consumed by, when it reacts with organic and inorganic matter, it becomes chlorine demand. Now what is this total chlorine? Total chlorine include the residual chlorine and combined chlorine. Now initially when you are adding chlorine, so chlorine will react with organic and inorganic matter. So it will form a combined chlorine. Once that saturation point has reached, that break point has reached, there will be free residual chlorine. So residual chlorine plus combined chlorine we can say as total chlorine. Okay. Just see this a picture, students. If you see this water, if you see this glass and you see this glass. So by seeing this picture we can make it here. The concentration of organic and inorganic material is very high. Here the concentration of organic and inorganic material is very low. So the chlorine requirement here will be very high and here it will be low. Simple, right? Okay, let's move to the fourth question now. All the following provide evidence of fecal pollution except. So all the following provide evidence of fecal pollution except fecal streptococci, coliform, Clostridium tetani or enteropathogenic virus. Try this, students. All the following provide evidence of fecal pollution except fecal streptococci, coliform, Clostridium tetani or enteropathogenic virus. Except, which cannot be used as an evidence of fecal pollution. Anyone, students? Okay. So Clostridium tetani or tetanus, it is not an evidence of fecal pollution. Okay, please remember that. So let's try to understand this bacteriological indicators of water supply. So bacteriological indicator, the most common is coliforms, we know that. E. coli becomes the most important microbiological indicator. Fecal streptococci, if you are getting streptococci in fecal streptococci, it indicates recent contamination, students. And Clostridium perfringens, not tetani. Clostridium perfringens indicate remote contamination. So three important points. The most important microbiological indicator becomes E. coli. Fecal streptococci, if you get, that indicates recent contamination, and Clostridium perfringens, if you get, that indicates remote contamination. An acceptable level of coliforms in drinking water should be 0, should be none, right? So fecal streptococci, recent, Clostridium perfringens, remote, and E. coli is the most important microbiological indicator. Okay, let's take the fifth one and let's be fast. Temporary hardness of water is primarily due to presence of calcium magnesium sulfate, calcium magnesium chloride, calcium magnesium bicarbonates, calcium magnesium nitrates. Try this, students. Temporary hardness of water is primarily due to presence of, yes, if I can see, many of you have answered C. Yeah, we'll talk about that. Option D also, just give me 1 minute. So calcium and magnesium, so temporary hardness of water is primarily due to presence of calcium and magnesium bicarbonate. So C is the answer. What you're asking, I'll just answer that also. Just give me. Hardness of water is due to all except sulfate, nitrates, chloride and phosphate. Try this. Hardness of water is due to all except Yugandhar goes with B. So except, which is not responsible for hardness of water. Yeah. No, hardness of water is due to all except this question. If it's chloride, no, it's not chloride. It's phosphate, students. It's phosphate, right? Okay. See, hardness of water, there is two ways of understanding it. One way of understanding is you can understand temporary hardness, you can understand permanent hardness. Now, temporary hardness is also called as carbonate hardness, right? So it's important. Can we divide as carbonate hardness, non-carbonate hardness, right? When I say carbonate hardness, so it becomes easy for us to remember. It will be calcium, magnesium, salt of bicarbonates. So it becomes carbonate hardness. So that is also temporary hardness. The moment we say non-carbonate, so it comes around permanent hardness, right? And now this permanent hardness can be due to sulfates, can be due to chloride, can be due to nitrates, but you don't see any phosphate, students. Are you seeing any phosphate? No. So the question was except what? So phosphate doesn't add to hardness. So four main compound which causes hardness, as you know, calcium bicarbonates, magnesium bicarbonates, calcium sulfates and magnesium sulfate. So carbonate and sulfate is definitely the most common word, but you can also get hardness due to chloride and nitrate, but not due to phosphate. Okay, so we have just talked about temporary and permanent hardness. Hardness of water is expressed, as you know, in milliequivalent per liter of calcium carbonate. 1 milliequivalent per liter is equal to 50 milligram of calcium carbonate, which is 50 part per million per liter of water. Okay, and you know how we level the hardness. So if I take 50 milligram per liter level of hardness, So it is soft water. So it is also, if you take milliequivalent per liter, it is less than 1 or less than 50 milligram per liter. So less than 50 is very soft, 50 to 150 is moderately hard, 150 to 300 is hard, and greater than 300 is very hard water. Now when we know this, so it becomes in sequence. The moment I know 50, so 50, 50 to 150, 150 to 300 and greater than 300, we get this value. It will be easy for us to remember. Now when do you recommend softening of water? It is recommended when the hardness is greater than 150, means when the value is under this, when it is under 3 to 6. So we recommend for softening of water, right? Okay. 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 Can we take the next question? Horrocks apparatus estimates free chlorine, combined chlorine, free chlorine and combined chlorine both, and chlorine demand. So Horrocks apparatus estimates what? What do you get from Horrocks apparatus? Free chlorine, combined chlorine, both free and combined chlorine, or you get chlorine demand. Students, try this. Anyone? Deepesh, Shadi, Monisha, Shriya. Somebody is going with C, somebody is going with D. Prem Patel goes with D, Shreya Thakur goes with D. Okay. Now, students, it is very important to understand this Horrocks apparatus. Okay. So, first of all, the answer to this question is Horrocks apparatus help us to know the chlorine demand. It helps us to know the chlorine demand. It does not help us to know whether it is free chlorine or combined chlorine. First, how it is done, how this function, I'll talk on that. Just take questions so that it will be based on question I'll be explaining is. For example, if the question is what is the amount of bleaching powder required to disinfect 455 liters of water if 4, 5, 6 cups shows distinct coloration in Horrocks apparatus. Read the question properly, students. What is the amount of bleaching powder required to disinfect 455 liters of water if 4, 5, 6 cups shows distinct coloration? Is it 2 gram? Is it 6 gram? Is it 8 gram? Is it 4 gram? Try this. And then I'll be explaining the concept behind this. So, anyone who has answered, is it 2 gram? Is it 6 gram? Is it 8 grams? It is 4 gram. Now, if you see, you have coloration in 4th cup, you have coloration in 5th cup, you have coloration in 6th cup also, students. In the question, it has not been mentioned which cup shows blue color first. Now, suppose if I take, Siddharth goes with 8, suppose if I take 4th color, so it becomes 8 gram. Why it is 8, I'll tell you. Suppose I take 5, it becomes 10. Suppose I take 6, it becomes 12. So, in Horrocks apparatus, if I have to say now, I'll say that the cup which shows blue coloration first should be taken and should be taken into account. So, example, and that has to be multiplied by 2. So, suppose 4th cup is showing color first, so it will be 8. If it is 5, that will be 10. If it is 6, it will be 12. So, if I go with 4, I get the answer 8. If I go with 5, I get an answer 10, which is not in the option. If I go by 6, it is 12, which is not in the option. So the best answer to this question becomes C. So this is the answer to this question. But what is the concept? I'll just take one more question and then it will become easy. In a community well water, Horrocks apparatus first shows 3rd cup blue. Right? Now here they are saying the 3rd cup is blue. What will be the requirement of bleaching powder for disinfecting 9100 liters of water? Now, it is 120 gram, it is 160 gram, it is 200 grams, it is 360 grams. Just try this, students. Based on the same concept, you can think of third cup is showing blue color. So I will multiply by 2, I get 6 gram. So 6 gram of bleaching powder is required to disinfect 455 liters of water. So 455, 6, so 9100, how much? Simple mathematics. So it becomes 6 by 455 into 9100. Do, students, whatever value you get, so you get the answer. And I think few of you have answered, it is 120, right? So the answer to this question is 120. Simple calculation, no? Third cup is showing blue color, so 3 into 2, 6 gram. 6 gram is required to disinfect 455 liters of water. So 9100 liters of water require how much bleaching powder? That is 120 gram, right? So the answer is A, not B, not C, not D. Okay. Now, okay, take one more. Which one of the following method is used for the estimation of chlorine demand of water? Is it Chlorometer? Is it Horrocks apparatus? It is Burke-Field filter? It is double pot method? Anyone? Try this. Chlorine demand of water, the best way of estimating is, we have just taken this question, we have taken the explanation also to certain extent. So the answer to this question also becomes, students, Horrocks apparatus. Now you see, one thing is common, is that we want to, for chlorine demand, how much chlorine is required to disinfect water, we need Horrocks apparatus. Now, can we understand this Horrocks apparatus in best possible way? You must have seen Horrocks apparatus. So there are 6 white cups. There is a black cup, which is not black here, but yeah, I'll take a black cup, and you have 6 white cups, which is 5 here, but we have 6 white cups, and we have 2 metal spoons. We have 7 glass stirring rods. We have an indicator called starch iodide, and we have 1 special pipette, and we have 2 drops, right? So these are the things which is there in the Horrocks apparatus. Now let's try to understand this. What we do, students, very easy. We take a black cup first, right? We take 1 level spoonful, means 2 gram of bleaching powder. Let's add 2 gram of bleaching powder in this black cup, right? And start adding water and make a thin paste. Make a thin paste till it has got a circular marking. It has got a circular marking. So till that you reach to that circular marking, prepare a solution which is called chlorine stock solution. So what I have done, I have taken 1 spoon, which is 2 gram of bleaching powder. In this black cup, I have added water, and gradually I am making a thin paste till the circular margin. So whatever solution I have prepared in this black cup is called chlorine stock solution. Now we have 6 white cups. Label it as 1, 2, 3, 4, 5, 6. Right? Now use the pipette which is there. Add 1 drop of stock solution to the first cup. So when you reach the white cup which you have labeled first, or first cup, please add 1 drop of stock solution which you have already prepared. In the second cup, add 2 drops. In the third cup, add 3 drops. In the fourth cup, you add 4 drops. And in the same way, in fifth cup, 5 drops. Sixth cup, 6 drops. You have added the stock solution now. Stir the water in the cup and use the separate rod for each cup. Wait for half an hour and then add 3 drops of starch iodide indicator in all the white cups. Once you have done that, students, just see which cup shows blue color first. The cup which shows blue color, you have to identify that, and in that cup you have to multiply by 2. Why? Because you have taken 2 gram of bleaching powder when you are preparing the stock solution. So if, for example, I have taken, if first cup develops blue color, you require 2 gram of bleaching powder to disinfect 455 liters of water. If, for example, second cup shows blue color, so you require 4 grams. If the third cup shows 6 gram, no, so subsequently you have to see which cup shows blue color. Is it clear, students? Any doubt in this? Horrocks apparatus, how it is done, how chlorine demand is calculated? Any doubt? Anyone? Very easy, student. 6 white cup, 1 black cup. You have to prepare the stock solution. Add 1 spoon, which is 2 gram of bleaching powder. Add water till the circular margin. That is your stock solution. Add the water which need to be disinfected in all the 6 white cups, labeling 1, 2, 3, 4, 5, 6. In each cup, add, for example, it is first 1 drop, 2 drop, 3 drop, 4 drop, 5 drop of the stock solution. Stir it for half an hour and then add 3 drops of starch iodide indicator. The cup which shows blue color first is your cup. You identify that, multiply by 2, you get the amount of bleaching powder required to disinfect 455 liters of water. Done. Right? Okay. Okay. Let's move to the next question. Orthotolodin test is used to determine nitrates, nitrites, free and combined chlorine in water, ammonia content in water. Students, try this. Orthotolodin test is used to determine. Let's be fast. Let's take a few more questions, students. Now, nitrates, nitrites, free and combined chlorine. Yugandhar, Christy, yeah, Utkarsh goes with C. Yes, absolutely right. Anyone else? Try, students. Vikas, Meena, Prachi, Monisha. Yes. Siddharth. Yes, it is free and combined chlorine in water. So OT test help us to know the free and combined chlorine. So there are 2 types of OT test, which free and combined chlorine. You have OTA also, which is orthotolodin arsenide test. It helps to measure the free chlorine and combined chlorine separately. So this is definitely has got advantage on OT test. Okay. Now, most undesirable metal in drinking water is iron, copper, zinc, lead. Try this, students. Most undesirable metal in drinking water is iron, copper, zinc, lead. Try, students, everyone. Yeah, Utkarsh goes with D. Anyone else? Yes. So, absolutely right. It is lead. Very good, student. Okay, let's move. Scabies and an infection of the skin caused by Sarcoptes scabi is an example of. Scabies, an infection of skin caused by Sarcoptes scabi is an example of waterborne disease, water-washed disease, water-based disease, water-related disease. Come on, student, try this. What do you think about scabies? Is it waterborne? It is water-washed, water-based, water-related? Utkarsh goes with B. Okay. Anyone? Yes. Very good. So it is water-washed disease. So water-washed disease, you know, infections of the outer body surface. So that may happen due to improper hygiene. So you have scabies, trachoma. So that is water-washed. Waterborne, as you know, typhoid, cholera, dysentery. It occurs due to the drinking contaminated water, fecal-oral route. So it is waterborne. Water-based, like guinea worm disease, is an example of water-based disease. And water-related disease, where, or you can say water-breeding disease, no, where the mosquitoes breed, like malaria, dengue, no, so that is water-related disease. Okay, let's take the next question. Let's be fast. All are water-washed disease except which is not a water-washed disease: scabies, trachoma, typhoid, conjunctivitis. Try this, students. Yes, oh, Ugandhar goes with C, I think. Yes, it is. All are water-washed. So scabies, trachoma, conjunctivitis we have just discussed. Absolutely. So typhoid is not a water-washed disease. It is a water-borne disease. Very good. Let's move fast. Psychrometer is used to measure. Psychrometer is used to measure humidity, air velocity, room temperature, radiant heat. Try this. Dipin, Mahesh, Jia. Psychrometer is used to measure humidity, air velocity, room temperature, radiant heat. Utkar goes with A. Yes, many of you are going with yes. So psychrometer is used to measure humidity. Absolutely correct, students. Yeah, so you know humidity. It is measured by dry and wet bulb thermometer, hygrometer, sling psychrometer, Asman psychrometer. Okay, let's take the next question. All of the following are type of mechanical ventilation except which is not a mechanical ventilation. Perflation, aspiration, exhaust, plenum, air conditioning. Try this. Yeah. Okay. Somebody is going with B, somebody is going with A. All are type of mechanical ventilation where mechanics is involved. Some mechanical thing is involved, machine is involved, except. So exhaust, if you say exhaust, air conditioning, it's required. No, it's a mechanical thing. Why will you be, why D? All of the following are types of mechanical ventilation except. So it is perflation and aspiration. This is not mechanical. Nothing mechanical is required here. Exhaust, it cannot work without electricity. All this requires something to work except perflation and aspiration. Yes. So, okay, we'll talk about that. Let's take the next question. The mechanical system in which fresh air is blown into the room. Read this question and that will help you to answer that understand the previous question also. The mechanical system in which fresh air is blown into the room by centrifugal fan so as to create a positive pressure and displace the vitiated air is termed as. What do you call this? You are trying to push the fresh air inside the room by a centrifugal fan so as to create a positive pressure and displace the vitiated air is called what? Balanced ventilation, air condition, exhaust, plenum. No, it is plenum. Students, it is plenum. Okay, just see this. So, can we divide ventilation into natural ventilation, artificial ventilation, which is mechanical? So, wind, diffusion. So, if a wind blows through a room, that is perflation, and it may exert a suction at its tail end, so that is aspiration. But exhaust, plenum, what exhaust we all know, we have seen. Plenum is fresh air blown through centrifugal fans. Balanced ventilation, there is a balance between exhaust and plenum. And air conditioning, we all know it takes factors into account, which is temperature, humidity and air movement. So the natural is aspiration and perflation. Okay. Okay, clear. All are indicator of air pollution except, right? All are indicator of air pollution except soiling index, McArdle index, suspended particle count, SO2 concentration. Yes, Monisha, very good. Yeah, Arnindam, anyone? Come on, let's be fast. Naresh. So air pollution, soiling index, particle count, SO2 concentration, everything is right. McArdle index is wrong. So this is not in air pollution. Okay. Now, what is McArdle maximum allowable sweat rate? Is it 4 liters per 4 hours, 4 liter per 1 hour, 4.5 liters per 4 hours, and 4.5 liter per 8 hours? Try this. Dr. Mahesh, Naresh, think 4 liters for 4 hours, 4 liters for 1 hour. No. It is 4.5 liters per 4 hours, students. It's 4.5 liters per 4 hours. Okay, please remember that. Okay, leave this. Now take this one. Kata thermometer measures what? Yes, Prasad. Kata thermometers measures what? Yes, 4 per 4. Moni, what is this? Kata thermometer measures for? Monisha goes with A. Siddharth goes with C. Absolutely right. Yes, so Kata thermometer measures the cooling power, students, which you know, which is air temperature. No, Arnindam, it is air temperature, humidity, and air movement both. C. So it is C. It's not A. Okay, let's take this one. The mean radiant temperature is measured by dry bulb thermometer, wet bulb thermometer, 6 maximum minimum thermometer, globe thermometer. Try this. We have to be fast. The mean radiant temperature is measured by. Yugandhar goes with B. No, students, it is globe thermometer. The answer is D. No, its answer is D. Okay, let's take the last question. Global warming. What is true in global warming? CO2 is a major greenhouse gas. Stratosphere, ozone layer is harmful. CFC increases. Kyoto Protocol call for 20% reduction in greenhouse. Try this. What is true in this? Yes, absolutely right, Sai Prasad. It is CO2 is a major greenhouse gas. So, okay, let's take the last one. Which of the following is not a source of indoor air pollution? Let's take this. Which is not a source of indoor air pollution? Carbon monoxide, nitrogen dioxide, radon, mercury vapor. Which is not a source of indoor air pollution? Try this. Okay. Since you answered this question, so what I'll do, I'll stop here, and tomorrow also 8:30 a.m. morning, students, I'm repeating 8:30 a.m. in the morning, I have a YouTube class on recent advances. Please join. That will be also, we'll be taking at least 30 questions, recent questions, which will help you to get updated on the recent component. So the answer to this question, you are absolutely right, everyone. It is mercury vapor. Very good, Deepesh, Meena, Prachi, Mahesh. So I'll stop here. I hope you have taken more than 20 questions, not less than that. And tomorrow 8:30 a.m. students, we have a recent advances class. I request you all to join there so that we can take maximum questions on recent advances. So that will help you to know what are the recent things which is there, at least those things which we expect that can be asked in the upcoming examination, right? With that note, students, I'll stop here. Thank you for joining, everyone. It was good interacting with you. I hope these questions help you in preparing. See you tomorrow at 8:30 a.m. in the morning.